EMRs and medication encyclopedias are very good for getting to the right diagnosis and right dose, but weak on preparing and giving medications. As Dr. eBroselow described in a separate video, a good 40% of medication errors are administration-related under stress. eBroselow helps improve medication preparation and administration with some novel innovations which I'll describe. These include referencing meds by indication, the concept of the virtual page, the visual concept of the therapeutic grid, and eBroselow's focus on the 5Ds. Diving right in, let's assume the doctor has ordered erythromycin IV for a 47 kilogram adult suffering from community-acquired pneumonia. I've selected the patient weight and now type the first letters of the drug name here and hit search. And this demonstrates the first innovation, which is referencing meds by indication. eBroselow not only shows the dose in the standard fashion, which is milligrams per kilogram per dose, but it has keywords or something we call indications, which indicate the intent of the physician. In this case, the doctor ordered the medication for community-acquired pneumonia, so I click here. Now we see what we call the virtual page. The virtual page has everything you need to administer erythromycin IV for a 47 kilogram patient. Everything is succinct and easy to find. It visually conveys information, as you see here in this grid. After all, humans are visual creatures. We make fewer errors when we look at things compared to reading things in paragraph form. The page also contains what Drs. eBroselow and Luton have coined the 5Ds for administering every medication. These are the dose in milligrams, you see here, the dose in milliliters for your selected concentration, so this is calculated for you by the tool, the dilution and mixing instructions. You can click here to see a visual table for how to reconstitute erythromycin and then how to dilute it. It includes instructions for delivering the medication properly, and it also makes sure that dangers and adverse reactions are recognized. Also, eBroselow has links through to medical encyclopedias. Here are a couple links that you can click through here. I'm clicking on the freedrugs.com link here. And here is the more typical format for a medication reference that you are familiar with, where there's reams and reams of information. So if I were using this, for example, to try to find the dose, I have to scan through and get through the mechanisms of action and testing and results of different studies. I need to scroll, try to find what is the proper dose, warnings, precautions. Eventually, somewhere here we go, you can find the dosage and administration. And even then, the dosing and administration I'd get in the encyclopedia is per day and milligram per kilogram, requiring the nurse or pharmacist to make the calculations to get the appropriate dose in milliliters. This is all done automatically by eBroselow. I'll show you one more basic feature in this video and leave the more advanced features for other videos. So going back to our medication here, and I'll scroll to the top, eBroselow gives the nurse the ability to double check a doctor's order. Say that the physician ordered 300 milligrams in this case. I would type in 300 here and hit the recalc button, and I can see that this is 25% above the standard for this weight. So if you include this with the double check on indication, this is another handy way to check dosing and improve safety. In summary, eBroselow is a simple tool for pharmacists to prepare medications, for nurses to prepare and administer medications, and for doctors to easily get doses and communicate to the rest of the team to ensure patient safety.